You know, as you described your organization and what you're doing and your mission and your vision, the word about played central to that description. And they said, they came back and said, it's a powerful word, but it's a very common word. But there's so much that we think you could do with it. And that's how the CEO and I looked at this as well. I mean, we both lit up as marketers going, man, wow, can you imagine how we can play off of this? But we also recognize there was risk.
That was Bob Zdon describing conversations with his branding agency and CEO on the bold decision to rename the company he works for, Central Logic, to About. Bob is the Chief Marketing Officer at About and has been deeply involved in the company's move to rebrand since joining a year ago. You're listening to What's My Tagline, a podcast focused on conversations around marketing, PR, social media, and more. I'm your host, Carol Flagg. And now let's hear more from Bob. Well, Bob, thank you so much for joining me today on this episode of What's My Tagline. How are you?
I'm doing great today, Carol. Thanks for having me.
Great. I'm really excited about this conversation. I've been looking forward to it the last couple of weeks. And so we're going to take a quick look first, though, at my standard question, which is, if you had to describe yourself as a tagline, what would it be?
I know that was it was an interesting challenge to go, what would that be?
I know. Every guest says that.
And, I ended up picking something, and it sounds so cliche, but I think it's really true. And what I think it is just don't sweat the small stuff.
Yeah.
At the end of the day, what we think is really important in the moment, whether that be in business or our personal lives, oftentimes isn't. It's having that perspective and being able to pull out and see that broader perspective and figure out what's really important, I think is ultimately what I like to think I do well.
Yeah. So, certainly last year and a half to 2 years has, perhaps made that cliche a little bit more powerful for a lot of people.
It certainly has. I mean, I think it's been every one of us, I think, in one way, shape, or form has reflected, just in our current times and things that we took for granted, ways we operated our life, ultimately changed for virtually everybody, right? In some fashion.
Right.
And, ultimately you do have that point where you look back and say, what is really important? And while, my day-to-day activities may have changed, at the end of the day, what has been important, what ultimately remains important, tends to be consistent.
Right. So before we get to the heart of the matter of our conversation today, tell our audience a little bit about yourself. I'd like to hear, just an overview of your journey, how you got into healthcare and how you ended up at About.
Sure. Yeah. I started out in healthcare at the very beginning of my career. I'm an engineer by trade, but yeah, interesting pathway, right?
Yeah.
But I always had that clinical bent to my career. I came out of school and actually started out on the clinical side, working in at the time, which was kind of a leading edge technology, artificial hearts. So I got a chance to work in that arena and work in a health system really for probably the first 10 to 12 years of my career, which I think really helped in getting grounded in terms of, what works well, what doesn't work well within a health system, and how the pieces come together. Ultimately, I made that transition into, more of the vendor side of the world, and, moved into sales and marketing, operations, finance, really spanning most facets of an organization, always in healthcare services and technology, though. So spent a number of years working with health systems around the acquisition and regulatory compliance issues related to medical equipment. And probably, 10 years or so ago, made the move over to healthcare IT and worked with several organizations on that front.
Yeah. The former meaningful use days, I guess some of the meaningful use is still around, but I would imagine you were involved in that as well.
Yeah, I was at an organization, Healthland, which was a EHR company, software company that focused on the rural healthcare marketplace. So we were right in the midst of meaningful use and that whole journey. Ultimately, we had a successful exit of that business and eventually moved on.
Yeah, great. So now you're at About, which actually is a recent change for the company Central Logic. So talk about your role at About, and I think that'll probably lead us and set a nice segue into the heart of our conversation today, which is talk about this rebrand.
Sure. Yeah, I joined About, or at the time, Central Logic, about a year ago now. And I have responsibility for our marketing efforts within the organization, as well as our product management functions as well. And, in a healthcare IT company, we really feel it's important that, marketing and product work hand in hand, and that there's a seamless process and, sharing of ideas and concepts and driving initiatives between those two organizations. So that's my primary focus.
And the decision to change the company brand, which I'm sure you were involved in every step of the way, and perhaps even leading that charge, from Central Logic to About, obviously I have to ask the logical question, what was that all about?
Yeah. Well, that journey started actually a little bit before I got here.
Oh, really?
A year or two before I joined the organization, our CEO and the leadership team at that point in time was looking at the possibility of rebranding. And it was based on the fact that as an organization, Central Logic, had been doing what they've been doing for 15 years, doing it really, really well, very successful in the marketplace. Though the vision of the organization and where the leadership team was taking the company at that time, and still do today, was something that was much more comprehensive, more impactful, and it started to change really what ultimately was going to be the execution to our purpose or our vision. And as we started to understand, brand equity around the Central Logic name, fit, did some work on that front. And this was right about the time I joined. We saw that at the end of the day, when we went out and did those studies, that the feedback we were getting from, whether it be healthcare executives or mid-level managers, was that based on the types of solutions that we were bringing to market, where we're heading from a vision standpoint, the name Central Logic didn't necessarily fit well, that we were about something much different. And so we started this journey and looking and saying, well, what does the naming process part of the rebrand look like? And, ultimately we worked with a great naming agency. And, as I'm sure you're aware, when you go through that exercise, there's all sorts of activities that you do to try to describe what the organization is about and where we're heading. And the naming agency came back, as you would expect, with several names and with rationale for each of those names. But the one that jumped out to both myself and the CEO immediately was the word about. And when we were talking to the naming agency about, they said, as you described your organization and what you're doing and your mission and your vision, the word about played central to that description. And they said, they came back and said, it's a powerful word, but it's a very common word. But there's so much that we think you could do with it. And that's how the CEO and I looked at this as well. I mean, we both lit up as marketers going, man, wow, can you imagine how we can play off of this? But we also recognized there was risk in picking really a general word like that, in that it was going to require detail and context behind it, right? Because it's just in and of itself, it doesn't say anything. But put in the right context with the right messaging, it becomes extremely powerful. And so very quickly, we settled on the naming part of the whole rebrand process and started to build from there. One of the things we saw in the feedback from audiences that reviewed the names was that it garnered a reaction, good or bad, when they first heard the word, right? You didn't really get that middling ground where folks are going, maybe, maybe not. It was either I really like it or I don't. But in both of those camps, the one thing we did see is the people that were responding came back and said, I want to know more. And that's what we really loved about it, was it invites a conversation. And it gives us the opportunity to explain what we do, how we impact the healthcare space, and ultimately help people learn more about our organization.
I've never, I was trying to think in my head, I don't think I've ever run across a company, certainly not in healthcare, where the name of the company was a preposition.
Yeah,
So
I know.
so it's a preposition. So you could, any noun, after that word is a great tie.
Yeah, and that's exactly what happened when we were describing our organization. And the narrative, and as we told this story, and our CEO is very passionate about what we do, and great person to work with and work for. And as she talks about the organization and she talks about the market needs and all the challenges in the market, it's about this. It's not about that. It's about this. It's not about that. And it really plays well in today's world, especially when we think about COVID and all the changes that are happening within healthcare, changes that are at a pace or a speed that's probably never been realized before in this space, at least not in my career. And so, what it was about 2 years ago is different than what it is about today, hopefully coming out of COVID, but certainly working our way through that process. Healthcare will never be the same. It'll, hopefully better. And I think in many cases it is better, but it's not what it was 2 years ago. And so that's why we felt the preposition about really helped us tell that story.
Yeah, it is sort of interesting that healthcare has for better or worse over the really gotten a label as a vertical as one that is slow to change, and yet the last 2 years have shown that when the industry needs to change for what I consider to be dire reasons, it can change quickly.
Yes, absolutely, and we've seen that, and they're responding. One of the groups that we've worked with was the state of Arizona, and it was amazing.
Yay!
Speed, right? Right. We're going to talk about your home state.
My home state. Woo-hoo.
Right. And when COVID first hit, and Arizona was fortunate from this standpoint in that some of the states out east, were hit first, right? And they could see what was happening. And the ability to load balance patients and get patients into a facility that could actually treat the patient, that infrastructure wasn't there and wasn't in place. So you'd end up with hospitals that were overloaded with patients, and then 2 miles down the road you might have a hospital with no patients, and the infrastructure just wasn't there to have all those organizations work together and facilitate and ensure that patients were being taken care of regardless of the timing or what's happening in a given facility. State of Arizona, it was amazing, in a matter of 2 weeks stood up at the state level a program that coordinated every hospital in the state of Arizona to manage patient inflow of COVID patients, to ensure that every patient that needed care got to a hospital that was able to give the care. And they did that utilizing our technology, but it tells you how quickly, not only how do health systems adapt, because to get health systems that are not part of the same organization to cooperate in that fashion so quickly and have the cooperation of government and the state was pretty amazing. And they facilitated a program that has gotten significant recognition. New England Journal of Medicine has written it up, among others, and we're very proud to be part of that.
Yeah,
we felt we brought some of the key expertise to make that happen in that short period of time. But it tells you how government and the private and public sector can work together very quickly to solve problems. So as we talk about healthcare and the speed and the ability to adapt to change, that's one example, but it's happening in a number of areas in healthcare. And there's things that are happening from a macro perspective that are driving that. Clearly, COVID has. We're seeing the staffing shortages that are happening in hospitals all across America. Hospitals have to move very quickly, and organizations that can help them do that, have an opportunity to play a key role.
Yeah. So you touched a little bit on the reaction of this rebrand from Central Logic to About, and I'm sure you did focus groups, and I'm sure that you had conversations, that involved the agency with your customers and whatnot. What were some of the challenges involved in that? I mean, obviously, I think whenever a company does a rebrand, there is a little bit of that, a little bit of a tightrope, right? That you walk, and certainly, I think that tightrope maybe becomes a little longer when the rebrand is a complete change. And having been familiar with Central Logic before the rebrand and now today, I see it. I mean, obviously it's a pretty dramatic departure. So just talk about that. I mean, because companies do, I think, and certainly listeners to this show do think about rebranding. You know, we're actually going through a brand right now ourselves, although not the name Healthcare Now Radio, but the logo and the look. And we, even at that level, we feel a little bit of that risk and like tightness in our bellies.
Sure. Well, for us, it takes courage, right? And when you look at the values, our values, and we started there. I mean, at the end of the day, I spoke about the naming, and in many respects, that process started very early. But looking at what is our core set of values, and courage being one of those key aspects for us, I would say the decision to move forward with the rebrand wasn't hard. We have, again, our CEO Angie Franks has such a depth of understanding of the space and such a passion for patient care. It became very easy for us to say, we do need to evolve, we do need to change, because we're going to help healthcare be better, help healthcare, heal in many respects. And so it started there. Now, the challenge in what we had was one that I've already spoke to, which is we have a generic word and we have to message and context around it. The second challenge that we really had also was we're dealing with a very complex ecosystem in healthcare, and the problem we're solving is very complex, and therefore our solution can be complex if not messaged in a proper way. So one of our big challenges through this whole exercise was, how do we ensure that we tell this story in such a way that it becomes very simple and very consumable to the audiences that are looking at About? And so what we ended up doing was bringing in a couple agencies that were fantastic in terms of helping us build that message and really challenge us in terms of, transitioning from where we've been to where our vision is sitting, which is out in the future, and creating a messaging platform that really allows us to speak to what we do today, but what that means over the longer term. And, I think for us, one of the pivots that we made in that process that they helped us really realize was, because it's so complex, to tell the why, the what, and the how all at once can be very challenging. And so we really focused in, when you start to look at our communications, and as we start to roll out the name and we talk about who is About, you're going to hear a lot about the why. Why is it important that we're doing what we're doing? And, bringing that humanity element into the story, I think what was one of the key, I don't want to say improvements, I don't know if that's necessarily a word, but certainly one of the key factors that we tried to build into how we brought this rebrand to life. And it permeated through everything we did, whether it be our employees, our stakeholders, being investors, or our clients, or what have you, was to really ground everybody on the why. And so for us, it was less about the courage to actually move forward with it. It was really looking and it was getting down to, what do we really do? What do we really do well? And why does that matter?
And so once you get through this rebrand, we'll finish up our conversation talking about what's next. Once you get to the rebrand and you've done all this hard work and you've told this pretty compelling story, what's next? What's next for the company?
Yeah, so one of the key things we're doing, we know that we're out in front of the market with our solutions, right?
Yeah.
Generally when folks are looking at buying what we offer, it's not like we're replacing something they already have. It's a new concept. It's a new way of thinking. It's a new way of delivering care in many respects. One of the key things we talk about is systemness, and we empower health systems to operate as one system of care. And so we know that's new, and therefore, because it's a newer concept and a newer approach, to fundamentally have the thought leadership programs that support our efforts in creating that brand awareness and building that brand equity was going to be essential. I'm really pleased this morning. We put out a press release that we've joined forces and partnered with the Malcolm Baldrige Foundation. And jointly, Malcolm Baldrige Foundation and About will be launching, starting in the first week of November, a bi-weekly podcast that will address all sorts of factors and issues going on within the healthcare space, really targeting that healthcare executive audience. And so that's one element of our thought leadership strategy or approach. And we are complementing that on a variety of fronts and creating content and what have you. But ultimately, at the end of the day, we know we need to educate the marketplace as we move through this process. And we feel that, and as an example, that relationship with Baldrige really gives us an opportunity to do that in a much more effective way.
Yeah, a new podcast, that's music to my ears.
I know, see?
Well, Bob, I want to thank you so much for joining me today. I'm going to use the rest of the day and I'm not going to sweat any of the small stuff. And
all right.
I really appreciate your time.
Well, thank you very much, Carol. I very much enjoyed it.
You can learn more about Bob Zdon on the company's website, abouthealthcare.com. And be sure to follow him on LinkedIn under his profile name, Robert Zdon. You can learn more about the show on the program page at healthcarenetradio.com. Be sure to follow me on Twitter at Carol Flagg or on LinkedIn. Have a topic or a guest idea for the show? Send me an email to carol@healthcarenetradio.com. Until next time, I want to know, what's your tagline?